The PSA test was based on the prostate-specific antigen, which was discovered by Dr. Richard Ablin. And he wrote a book in 2014 called The Great Prostate Hoax. In an interview I saw, he was asked, have you ever had a PSA test on yourself? And he said, absolutely not. So even the guy who was basically the founder of the test has never had the test. Welcome back to Second Opinion with Dr. Jesse Haggard and my buddy Virgil.
What's up, what's up?
And we're going to continue on our topic from last time about testosterone and prostate cancer. And we promised everybody at the end we were going to talk about the PSA test.
Yes.
So the PSA test stands for prostate-specific antigen. What do you know about the PSA test?
Nothing.
Okay.
I know absolutely nothing about it. That's why I'm very interested. So you're going to actually see me kind of quiet because now I'm going to have to learn something.
Well, to understand the PSA test, we're going to talk a little bit in depth about it. We're going to cover some numbers, talk about some statistics. So after last time's episode, I thought it was appropriate. So I got you a special cup.
So, like we said in our last show, I went to Harvard. I wasn't lying. Kind of telling the truth a little bit, you know. We sell these mugs, by the way. No, I'm just kidding. I'm just totally joking.
This is a blood test
that
guys get in order to screen for prostate cancer. So the PSA test is what we talked about in the last video. I even said that I had given the patients in the beginning PSA test, and when it was elevated, did like what I was taught to. Oh no, we need to do more testing. We need to figure this out. So since then, though, especially when I went in my deep dive after a couple years of having patients that responded well to testosterone with prostate cancer and their PSA levels normalized, and so did their other things like biopsies, imaging. And then I started to ask, well, what do I know about the PSA test? The PSA test was based on the prostate-specific antigen, which was discovered by Dr. Richard Ablin. And the antigen was never meant, he says, to be a cancer screening test. His own father died of prostate cancer, and he got into prostate cancer research, I understand, based on his father's condition. And even then, he says he was never able to find a good cancer screening test like that. So they turned it into a cancer screening test, even though it didn't really support that. And he wrote a book in 2014 called The Great Prostate Hoax, which he says basically that the government stole his prostate-specific antigen and made it into a test and marketed it inappropriately as a cancer screening test. I mean, this is the doctor who basically founded the test. He developed the main thing the test is based on, and he says it's not an effective screen. And in an interview I saw, he was asked, have you ever had a PSA test on yourself? And he said, absolutely not. And he said, but your dad had prostate cancer. And he said, yeah, but that's not what the test does. So even the guy who was basically the founder of the test has never had the test. His dad had prostate cancer, and he has no intention on having it.
So what's the purpose of the test?
Well, unfortunately, it causes more harm than good. And that's where he says too. And then another organization, the NNT is the numbers needed to treat. And it's an organization that takes medical statistics that can be complicated to a lot of people, and they try to put it in easy to understand terms. And how they do it is the numbers needed to treat, basically saying, okay, so how many people need to be treated for one person to have a benefit? And in their analysis of the PSA test, it was 0 had benefit. And in fact, 1 in 5 had harm because they had an unnecessary biopsy.
Was there even deaths occurred?
Well, after they get the biopsy, the harm doesn't stop there. Many people, because of the biopsy or the elevated PSA test, which started the whole thing in the first place, end up having unnecessary surgery, unnecessary medications, chemotherapy, radiation.
So it's just a money grab. That's all this is just a money grab.
I mean, according to Dr. Ablin, he says the government made billions off of it. And not just in this country, in other countries too.
So they use this PSA test in other countries as well? And how long ago has this test been made?
It started in the 70s.
In the 70s? Do they still use this test?
They still use it, and medical organizations still, they promote it.
So basically, they're making money still off of a test that is bullshit.
So it seems that the test is based on politics and fear, not data. I mean, the NNT is a good example to show that it does nobody any good and harms 1 in 5 guys.
Well, clearly, I mean, let's be
like,
honest.
why isn't it illegal?
Yeah, and here's the other exactly. But here's the deal: anyone that has a death scare, like if someone told me, "Here, you need to take this test," and then they're like, "Oh, it's saying that you're gonna die." Like, of course I'm gonna be scared. I'll do whatever the fuck they want me to do. You know what I mean?
Well, I also think that doctors are doing the PSA test because if they don't and something bad happens, then somebody might say, "Oh, why do you run a PSA test?"
Oh, wow. So is it like...
Well, I'd say I would feel confident these days as a physician to say, not that I'm practicing anymore, but I would feel confident with this information to not perform the PSA test on anybody for cancer screening. There might be other reasons to do it if you have a different condition, because PSA just measures prostate activity. So if you're measuring sort of treatment response, that could be a reason to do it, but otherwise it's a terrible test to screen with. Not only did it not help reduce any prostate cancers when they did the analysis, it didn't help with any mortality across the board.
You know what we should do? Maybe I should go in as a secret person just to see if they still do this bullshit. I'll totally do it.
No, actually the easiest thing to do is to go in and that list of symptoms from the Adam questionnaire.
Yeah.
If you complain of number 1 or number 7.
I'll say I got 1, 7, and 10, and 4.
If you have any of those. And then they recommend, okay, let's do a testosterone level and a PSA level. Why do we need a PSA level?
Should I ask it? And then I'll ask it, like I'll literally have a secret camera on. And I'll go, well, why do we need a PSA level? Just to see if they're doing the steps of what it is to rip someone off. Like, that'd make good TV, because then we know that they still do it to this day.
Oh, no.
Who wants me to do it? Say yes.
These are organizations in 2025 that teach
Still
you
do
about
it.
this.
That is insane.
Yeah, the American Urological Association, I believe, still is one of them. I mean, that's
and
their
this test
specialty.
is bullshit.
And that's their specialty, is urology.
Oh my God. Like, I want to just do it just to show everybody how fucked up it is just to put it to the test. I'm game. I like to stir shit, you know what I mean?
So, besides the NNT, trying to take medical statistics and putting them into easy to understand numbers. So, in 1 in 5 were harmed, nobody was helped, and then you start looking at the same with cancer numbers. And this article came out in 2009, Lies, Damn Lies, and Cancer Statistics by Peter Albertson. Phenomenal article. It was in European Urology, and he gives specifics on how prostate cancer studies have been misinterpreted and misused in the media and medicine. So what we're getting at so far in this whole story of testosterone and prostate cancer and now testing, all of it's based on politics. And you got all these guys that they've heard about testosterone, they're interested in testosterone, but their doctor's scared of it for heart disease and cancer.
And if they don't go by the rules of what the government wants them to do, basically, then
or the medical boards.
Or the medical boards, yeah. Well, I'm not saying government medical boards. Whoever makes the rules, if they don't follow them, they're gonna get fucked.
So
right.
But here's the thing that is the final argument to me in this whole lineup of you got to do this check, this check, this check. Is this Lies, Damn Lies, and Cancer Statistics article points out that the numbers they report on how many people die from prostate cancer are very taken out of context because they're based on large studies of who got screened. But then it doesn't count the people who never got screened in their life. And then it also doesn't account for non-attendance, which is people who are in the studies who don't actually get the screening. They didn't show up that day. They get counted in the positive direction. And then also the contamination, which is the people in the control arm who get screened outside the trial. Because they're the ones that aren't supposed to get screened, but then they end up getting screened somewhere else. And they don't have a way to count for that.
Wow.
So, and then you have a bunch of people that are actually diagnosed that they don't follow or they don't continue on to find out that these people will never develop any significant clinical problems and like never have a tumor, death, any sort of symptoms. And so you kind of look at all that when you look at these numbers, and even then, after you adjust for this, it comes out to be something like, the last I looked, it was 19.2 per 100,000 people die from prostate cancer in a year. So that's 0.0192. So 0.02% of men with these kind of inflated numbers are dying from prostate cancer a year.
Wow, that's insane.
So,
and is it still that statistic now?
yes.
That's insane.
This is
and
what
back
this
then,
is what
back then too.
This is what has been reported by several different cancer studies and cancer organizations.
So why isn't other people wanting to put their foot down and say, what, like, is there not enough people to go against it or what?
Somehow,
because they're scared to lose their
somehow
license?
This train of thought that we've been following, right? Most doctors don't know all the steps. And so they can't put it all together saying, okay, if testosterone therapy is effective in men that have low deficiency or, those deficiency symptoms, so they have low testosterone, so they have these symptoms, they should do a blood test. And if they do a blood test and they show they're low, we've already covered that testosterone treatment is effective in those people. It's safe because it doesn't increase heart disease and increase the risk of cancer. And even if you have either of them, it's not going to make it worse. Most likely make it better. Make your condition better, make your quality of life better. And then the PSA is meaningless, basically, especially when it comes to should somebody start testosterone therapy or not, because it doesn't detect cancer, but cancer doesn't get worse anyway with testosterone treatment. So the end part, though, is most guys are going to die of something else besides prostate cancer, even if they have prostate cancer.
How much they charge for this test?
Well, a lot of people's insurance cover it.
How much? But they rock their
besides
insurance.
that, it could be anywhere from $20 to $40 each time. And it's not one, you don't do it once.
Oh, it's every time?
You do it regularly throughout your life. I mean, the last screening results I saw, they recommend it, I think it was U.S. Preventative Task, where they recommend this screening test to be done every year from age 55 to 70. And then if you have an elevated one, then they recommend follow-up ones more often and so forth. And if you're going to start testosterone, then you're supposed to have it even more often.
I would love to just go in just to see what they would do. You know what I mean? Like, just to put it to the test. I think it'd be interesting to do. You know what I mean?
Yeah. Well, just start talking to people who are on testosterone and ask them if they've had a PSA test. The majority are going to say yes. So the biggest issue, though, is I hear this all the time. Oh, I was on testosterone and my PSA level went up and my doctor took me off testosterone and said, we can't do testosterone anymore. Show me the studies that support that logic. There are none.
And you know what's messed up too is a lot of people take testosterone illegally because they don't want to pay all this money through the doctor.
And
you know
I'm not
I mean?
condoning that, but what I'm saying is, even if you were taking it without doctor supervision, would it be smart to get a PSA test?
No.
The answer is no.
So it's like they're kind of smarter doing it illegally.
Well, or at least not
you
worrying
can't
about...
say that I know, but
not worrying about the PSA test. I mean, nobody should worry about the PSA test in regards to prostate cancer or testosterone therapy.
Yeah.
It doesn't matter. In fact, it's only going to put a wrench in everything and make your outcomes worse. Because even if you're elevated PSA test, or you got an elevated PSA test, and you don't follow up with it and don't do anything, well, now it's messing with your mind. You're probably thinking in the back of your mind, oh my gosh, I might have prostate cancer. And now you got like emotional damage.
Yeah, and then you'll do anything, because now they've got you emotionally fucked up to where they can really rig you and get you and rip you off, because I'm sure they do that. I know you can't say anything, but I'm sure they do. You know what I mean? Charge you prescriptions of things you don't need and doing all these things to scare you from this test, right?
Yeah.
So fucked up!
So I feel that the current accumulation of scientific data strongly supports that no man should have a PSA test for cancer screening.
Now, if a doctor went against those rules, what would happen?
I would think that the doctor would be smart enough to show all these articles that we've already just briefly discussed, looked at. There's so much more as far as scientific data goes. They've done meta-analysis, systematic reviews of this. I mean, this is everywhere in the literature, but I don't see it in clinical practice. When I talk to people who are getting these therapies,
yeah,
they all have PSAs. And and a lot of them are worried about it, and often I have to have this conversation, and that's why I wanted to do this video.
Yeah.
Is so that next time somebody tells me, oh my gosh, I have an elevated PSA, I can say, watch this video because it's not important, and here are the reasons why.
Well, let me ask you something. So, I understand they still use it nowadays, but, is Is it mandatory? Does a doctor mandatory have to do this if they have prostate cancer?
The doctors shouldn't have to do it, but depending on which organization they are a part of,
Their rules might
then
make
they
them do it.
might have,
They're
guidelines.
scared.
It
They're
might
scared.
be guidelines. But
Yeah.
I'm telling you, most doctors are scared of not doing this test that I've spoken to in the last few years, because what if something happened, and that's how they were taught in medical school, even though their medical school taught
It's kind of like a
20 years ago.
backup safety plan for them,
Right.
government-wise,
But
or doctor medically-wise.
But at the same time, the number one thing to become a doctor is first do no harm. So where did that go?
That's an argument that they can do. But I mean, a lot of doctors are scared. Like they do the checklist rules. They don't like that. In my vision, I just think they want to do the checklist rules, no matter what it is, no matter what their rules are, because it's their rules. And if they don't do that, they're probably scared to lose their medical license, right?
Right.
So they do this, even though it's pointless. They still follow the rules that they said to save their ass. Correct?
Correct.
That is so messed up.
But
So
at the same time,
what can we do to fix this?
well, I'm hoping that this will educate a lot of people. And, I love the idea also, hey, I've been wrong in life before. And
No
if I'm
way.
wrong, if somebody has any sort of data to back up against
Proof.
this, leave it in the comments.
Yeah.
Show us the data behind it.
Yeah. If someone could prove differently, let us know what's up.
So thanks for joining us, and we'll see you next time.
I can't wait.
Follow my podcast on drjessehaggard.com.